Thanks for joining us at 4:30. I'm Susan Kim.
And I'm Ryan Jenkins. The demand for naturopathic medicine is growing.
Lakeside Natural Medicine in Shorewood is shaping the way patients receive care through naturopathic licensed doctors.
Yeah, and today's Steph Connects. Steph Brown goes to the clinic to meet them. Hey, Steph.
Yeah, hey there, guys. Okay, Dr. Sarah Axtell first started her practice nearly 20 years ago. Back then, she rented a small space and did everything in the office. She's since grown, hiring 3 female doctors and moving into a beautiful office in Shorewood. I wanted to get a general idea of naturopathic medicine and how Lakeside is approaching the growing practice. Take a look.
It was always a dream of mine to have a teaching kitchen or a food as medicine kitchen. So my passion is food as medicine. That's what I practice with each and every patient. You know, we view food as so much more than calories and so much more than fuel. It's information to our cells. It can increase or decrease inflammation. It can change gene expression. It can balance the immune system and it can balance hormones. It can be the source of what's ailing us, but it also could be the most powerful medicine. That's what we're doing here.
What's the difference between, do we call it modern medicine versus naturopathic?
Yeah, so conventional medicine is what I would say. We're both trained as, primary care providers, or we could both go to medical school, I would say, a medical doctor with a naturopathic doc versus a naturopathic doctor.
Okay.
But we are trained as the medical experts in the natural therapies. We have very similar training as conventional medical doctors. So we go to a 4-year accredited naturopathic medical school where we learn all the basic sciences and clinical sciences.
Tell me a little bit about why this journey for you and what it took for you to have this beautiful space.
Yeah, I went to medical school in Portland, Oregon, a city of similar size to Milwaukee, and there's 500 naturopathic doctors there. Versus Milwaukee, there's less than 5. So I knew I wanted to pioneer this medicine back to the Midwest where really, truly there's a need.
Well, and that's what I loved about this story. 4 female doctors, your dedication to getting this up and going, your fight to make sure that you are legitimized, because there are going to be some people who watch this and say, oh, they're just a bunch of witch doctors, or how much food can you consume to make a difference?
We are trained as primary care providers, and we know pharmacology, we know the basic sciences, clinical sciences, but we also know those natural therapies that a lot of people are seeking. We work collaboratively with medical doctors and DOs and nurse practitioners. I think it's really that team-based approach, and we spend a lot of time with our patients to sit down and listen to them and understand what is that root cause. We order labs for patients that helps to identify root cause. So that may be food sensitivity testing, maybe hormone testing. A lot of people come to us for digestive complaints when they just aren't maybe getting answers at their GI doctor. My mission is to educate, inspire, and empower people to take control of their health using food first, using food as medicine.
Where do you see naturopathic medicine going?
I see it as the medicine of the future. I think people are demanding this kind of medicine. They want answers. They feel dismissed and frustrated and invalidated oftentimes with the conventional medical system. And there's a place for the conventional medical model. There is, to put out fires and for urgency and acute conditions. But for chronic conditions where people really want to get to the root, that's where naturopathic medicine thrives.
Okay, so now we're going to meet Dr. Meister.
Yeah, Dr. Meister. She's going to talk about some medicinal foods for the gut.
And stay with us. That's coming up on Monday. We'll meet one of the other female doctors at Lakeside who illustrates the philosophy of food as medicine. She, along with Dr. Axtell, who you saw in the story, both have been very instrumental in getting the state to require naturopathic doctors to be licensed by the state. So I'm diving in, you guys. I'm trying to get to the bottom of this and make a connection and bring it to our viewers.
Well, and the thing is sometimes when people are so frustrated because they don't have answers, this is another option.
Exactly. It's another option. And they emphasize working collaboratively with your doctors so that it's a collaborative effort. It's not just one or the other.
Can we just rent out that space?
Right.
Right? It was gorgeous. Gorgeous, you guys.
Thanks so
Gorgeous.
much, Steph.
Yeah.